Welcome to the Family Medicine Clerkship. This video is intended to be a brief orientation to the clerkship, and all of the information that I am about to share can also be found in the syllabus. You will have an orientation with your regional campus clerkship director, and there will be an on-site orientation with your attending on the first day of your clerkship. This clerkship is designed to introduce you to family medicine, the primary care specialty, and to provide you with an opportunity to care for patients in the ambulatory setting. You will provide supervised care to patients with a broad range of conditions in the context of family and community. Family physicians care for patients across the lifespan with a focus on prevention, acute care, and chronic disease management. Although some of your day-to-day experiences may vary, the learning opportunities will be similar. I promise this will be a robust and broad experience in direct patient care. Some of you may have additional opportunities to see patients in the hospital setting, skilled nursing facilities, hospice, home visits, sporting events, and clinics designed to care for those without adequate medical insurance. In place of a required textbook, we are using the FM cases in the Family Medicine Clerkship. There are 40 cases on a variety of topics, and you are required to complete 4 basic cases that include a wellness visit for a man and a woman, hypertension, and diabetes mellitus. In addition to the 4 required cases, you must complete at least 2 additional cases from the FM cases selection. You must record at least 100 patient encounters in the ambulatory setting, with 80% at the moderate or full level of participation in care. You will use eValue to log your encounters. I encourage you to do this in real time or at least every evening, and to record all of your patients, not just the minimum required. If you have questions about any of the patient encounter requirements, please contact your clerkship director or me for clarification. There are 30 conditions that must be documented, all of which are commonly seen in the ambulatory setting by a family physician. If you are unable to see a patient with a particular problem, your clerkship director will likely assign a specific article or one of the FM cases that corresponds to that condition. Prevention is a large part of family medicine, so there are required healthcare screenings that must also be documented. These are grouped into A and B recommendations, and there are active links in the syllabus to the United States Preventative Services Task Force website so that you have access to more detailed information. You are also expected to screen both children and adults for recommended immunizations. There are 2 assignments in the Family Medicine Clerkship that must be completed prior to the end of the clerkship. The first assignment is your personal educational goals, and the purpose is to encourage self-directed learning. You will choose 3 educational goals specific to your own current learning needs, but they cannot be a clerkship requirement. They can be a specific skill, knowledge in a particular content area, or a behavior you wish to modify. You will then develop a strategy to achieve each goal during the 6-week clerkship, identifying appropriate resources and selecting targets by which you can measure your own progress. Be sure to discuss your educational goals with both your clerkship director and your clerkship faculty at the beginning of the clerkship. Then you will submit your proposal to your clerkship director by the end of the first week so they can provide feedback on your strategy. During the rotation, you will track your progress and then write a final report that is submitted through student academics. More detailed instructions and an evaluation rubric are located in the syllabus. The second assignment is the systems project. The purpose of this assignment is to highlight the systems of care and how they can impact access and coordination, and thus patient outcomes. You may choose one of 2 options, either the referral or the cost of chronic care project. Specific instructions and evaluation rubrics for each of these options is available in the syllabus. The referral project is designed to demonstrate the interprofessional teamwork and collaboration between healthcare professionals in the care of a patient, and to emphasize the potential for systems errors when care is not delivered continuously. The Cost of Chronic Care project is designed to highlight the financial impact to patients based on our recommendations and to demonstrate the importance of evidence-based guidelines in the clinical care of patients as related to medical management of chronic conditions. In addition to orientation, you will meet with your clerkship director every week during the rotation. If you are in Immokalee, this meeting will be arranged through video or teleconference. During these meetings, you will discuss FM cases, present patients, review progress on required components of the clerkship, and run through sample test questions. One of the weekly educational meetings will be devoted to the pharmacy field trip, during which you will review common over-the-counter medications taken by patients and compare the options they are confronted with when choosing a remedy. At least once during the 6-week clerkship, your clerkship director will directly observe your clinical skills during one or more patient encounters. This may occur in the office of your clinical faculty or in the office of your clerkship director. You will be asked to self-assess on your clinical performance, and then your clerkship director will provide you with feedback on history gathering, physical exam skills, clinical reasoning, and oral patient presentation. As you approach the last 2 weeks of the clerkship, be sure that you have completed the required FM cases and worked on both assignments. There will be a practice exam through the FM cases curriculum so you can gauge how to focus your studying for the NBME. For students on the LIC, think about wrapping up your cases and assignments by winter break. NBME prep materials are available through the AAFP website, ABFM smartphone app, and through your clerkship director. On the last day of the clerkship, you will take the NBME Family Medicine Subject Exam. This includes the 80-question core plus an additional module on chronic conditions. More details on all of the items discussed in this orientation are available in the syllabus. The components of the clerkship that are evaluated and included in the grade determination include professionalism, NBME score, clinical performance, completion of required encounters and FM cases, personal goals, systems project, and performance in weekly educational meetings with your clerkship director. Feel free to contact your clerkship director, DL, or me with any questions. Enjoy your family medicine clerkship.